Hello and welcome to Healthy India. I'm Lottie Yalaric. Well, folks, this is your show wherein we talk all about health. We tell you as to how to catch the symptoms of certain diseases and how they can be treated and what can you expect in terms of treatment. Well, these days we all know that dengue fever is in the air. So we decided to talk about dengue fever. Most of us are scared and some of us just do not know how to deal with this disease, and there are also a lot of myths that are associated with this fever. So these are the things that we'll try and find answers to today. So I have in the studio an eminent panel of doctors. I welcome Dr. Sunil M. Raheja, who's a physician from the GB Pant Hospital. Sitting to his right is Dr. Pawan Kumar, who's the CMO of the Directorate of Health Services with the Government of Delhi. And to my left is Professor Dr. Bir Singh from the Center for Community Medicine at the All India Institute of Medical Sciences. So I take this opportunity of welcoming all of you to the show. Well, people, before we actually start telling you about the disease in a question-answer form, and before I invite you to ask your questions, let us all take a look at this report.
Dengue is the most common mosquito-borne viral disease that has become a major health concern in recent years. It is transmitted to humans by the mosquito Aedes aegypti and rarely Aedes albopictus. Classical dengue or dengue fever is characterized by a sudden onset of fever, joint and muscular pains, headache and rash. There may also be gastritis with some combination of associated abdominal pain, nausea, vomiting or diarrhea. Some cases develop much milder symptoms which can, when no rash is present, be misdiagnosed as flu or other viral infection. The classic dengue fever lasts about 6 to 7 days with a smaller peak of fever at the trailing end of the fever and can be diagnosed through a blood test. The mainstay of treatment for dengue is supportive therapy. The patient is encouraged to keep up oral intake, especially of oral fluids. However, supplementation with intravenous fluids may be necessary in some cases for preventing dehydration. Like most viral diseases, there is no specific cure for dengue fever and no vaccine for its prevention. Primary prevention of dengue mainly resides in eliminating or reducing the mosquito vector for dengue. Personal prevention consists of the use of mosquito nets and repellents.
Well, people, now let us actually start with the doctors and try to find out as to what does dengue fever really mean and how does the disease actually manifest itself. So, Dr. Raheja, before I even ask you that, I'd like to ask you as to what is the prevalence of this disease really? Because why I ask you this is because every other day we hear a lot of cases coming up, especially in Delhi.
Yeah, basically, dengue is it is present to the level of 2.5 to 3 billion people in the world. They live in the hot zone.
Right.
I mean, these are the population which is at the risk of dengue fever, and it is more common in the tropical, subtropical countries like India, Pakistan, Sri Lanka, Bangladesh, Southeast Asia, and West Pacific and African countries. And more so, it is more common during the monsoon weather,
right,
between July to end of November, December, because that is the time when the mosquito breeding is maximum. The mosquitoes, they breed maximum in the fresh water, and the optimum temperature for their breeding is around 16 degree to 40 degrees Celsius. So basically, it's a mosquito-borne disease transmitted by the Aedes aegypti mosquito, which is also called the tiger mosquito. The best way to see this mosquito, it's a day bitener, and it bites during the daytime, early morning or before the sunset. And as far as Delhi is concerned, a day before yesterday, there were 5,899 cases of dengue fever diagnosed,
right.
and 30 new cases were reported a day before that.
Okay, so which is a huge number, obviously. Okay, so now Dr. Kumar, we all know that especially in India, if somebody comes down with a fever, the first thing that they will do is that they will just buy some over-the-counter medicine and take it. So in this scenario, don't you think that a number of cases may also be going undiagnosed because people may just be thinking that it is a normal fever which might go just with any tablet at all?
Yes, actually in India or in some another area, we see a lot of cases of fever, they come. The features, clinical feature which come under dengue fever is the fever for 2 to 7 days. Right. But there are some symptoms which differentiate it from other fevers like myalgia, arthralgia and retroorbital pain and some rashes on the body.
Okay.
But in case of other fever which are common, maybe the malaria, there is a Raigan and chills. But chikungunya fever, the same feature can be there. But with the clinical diagnosis, with the clinical picture supported by some serological test, we can clear-cut say that this fever is of dengue, dengue type.
Right. So, Dr. Singh, can you just simplify these symptoms which Dr. Kumar has just elaborated for us? Can you just tell the people as to what are the symptoms which in their parlance, if they can understand?
You see, the point is, let's be very clear about one thing. Dengue is not a disease which is confined to India or Delhi.
Right.
It's a worldwide disease.
True.
Except some countries in Europe, every other country suffers from it. This year also, we have been having lots of cases in Southeast Asia, including India. That's one fact. Secondly, the symptoms, as Dr. Just now said, the fever starts with high-grade fever, acute onset, sudden onset.
Right.
And the patient has severe headache, mainly behind the eyeballs,
Okay.
and headache basically all
Right,
over,
right.
and body aches all over the body, and person may also have pains in the smaller joints.
Okay.
So this is one classical symptom which actually is suggestive of some kind of dengue-like fever, which has to be confirmed by certain laboratory tests.
Right.
At the same time, the person may also have feeling of weakness, loss of appetite, a bit of gastritis, means burning in the epigastric area or the stomach area. So these are the symptoms. As the disease progresses, one can also have rash, like granules on the body,
Okay.
basically suggestive of some kind of some kind of allergy-like symptoms. And then, if the disease actually acquires a bit of serious form, the person may also have symptoms which are bleeding from gums, bleeding from nose, bleeding under the skin, bleeding in the stool,
Okay.
and in the vomitus. But those symptoms are basically suggestive of a disease which is called as dengue hemorrhagic fever or dengue shock syndrome. Those are the diseases which are basically types of dengue, but rather uncommon.
Right.
I would say classical or simple dengue fever is the commonest form of dengue,
Okay.
and which actually gets all right within 6 to 7 days with some basic treatment.
All right. So, Dr. Raheja, if somebody does see these kind of symptoms, say in anybody in the family or something, so what is the first thing that the other members of the family can really do?
Yeah, the first thing is the fever comes with high grade with chills. So first thing, as we have already discussed, it can be mild in most of the cases, and the mortality in classical dengue fever is less than 1%, and just they need a symptomatic treatment in the form of hydrotherapy, tablet paracetamol, and they should take lot of liquids in the form of fluids, like they can take juices and water, ORS, commercially available electrolyte solutions. They must maintain the hydration, and at no circumstances they should take the aspirin or diclofenac, brufen for controlling fever, because these drugs, they act on the platelets. And in dengue we already have a qualitative as well as quantitative effect of the platelets, and once you take these medicines, they can lead to these serious complications in the later course of the disease. The only safest drug is paracetamol, and if the person is having high grade fever, that can be taken care at home also. And in 99% of the patients, we just need domiciliary home care, and only in few patients you need admissions. Those cases are like patients of dengue hemorrhagic fever, which have bleeding from the nose, decrease in the platelet counts, they have petechial hemorrhages or bleeding in the urine, in the vomitus, in the stools.
Yeah, which
they need more care. And if in the severest, in the very severe form dengue shock syndrome, the patient's blood pressure can fall. There can be thin thready pulse, fall in the blood pressure, low pulse pressure, patient can be drowsy, disoriented, and these are the patients which need definite hospital care. They need IV fluids, and in few cases, very, very few cases I will say, when the count of platelet goes below 20,000, or if there is a bleeding from the any site, then you have to transfuse all these issues, and these are the patients which should be admitted. And the mortality in dengue shock syndrome is very high. It can be 5 to 44%, depending on the medical care the patient is getting.
Right. Now, Dr. Kumar, Dr. Raheja just mentioned, the platelets, the count of platelets going down. Now, these days, you hear all around that people say that if you take the juice of, say, papaya leaves, that's going to help. Now, is that a myth or is that something that they can try?
Yeah, there is no clear-cut scientific evidence whether we take juice or some kind of these things, they will really increase or decrease the platelet count. What happens in dengue fever, because of virus attack on the body, there is a vascular permeability, which causes the fragility of capillaries. And the megakaryocytes, from which the platelets they are formed, they are in an immature form. So less amount of platelets they are formed. And because of intravascular fluid leakage, lot of platelets they are actually aggregated inside the body. So overall the body platelets they comes down. So that is why main clinical, when we do the clinical laboratory examination, there is a platelet count fall. Once Dr. Saab has said that there is a dengue fever, then is a dengue hemorrhagic fever, then dengue shock syndrome. In dengue hemorrhagic fever, the platelet, when we call it dengue hemorrhagic fever, when the platelet count is less than 1 lakh per cubic millimeter of blood, the platelet count, patient is okay at that moment. The platelet count may fall down up to 20,000. If patient does not have any bleeding symptom or spontaneous bleeding from nose or epistaxis or bleeding from the gastrointestinal tract in the form of melena, black stools, or bleeding in the vomiting, even if the platelet count is low, nothing has to be done, only supportive management or hospitalization and day care should be there.
All right. Well, people, I do hope that you are listening very carefully to what the doctors are saying today, and if there are any myths, and please don't go by them, all that you need is proper medication under the supervision of a proper doctor. So do remember all these things, especially if you think that you do have the symptoms of dengue. So while you think about those, we'll slip into a break, but do come back quickly as we'll be back in just a moment.
आज मौसम तो काफी खराब है, कहीं तूफान तो नहीं आएगा? रेडियो पे सुनता हूँ।
तूफान की आशंका है, मछुआरों को सावधान किया जाता है कि वो समुद्र की ओर ना जाए।
कमला, तूफान आ रहा है। हाँ? सेफ्टी किट कहाँ है?
हाँ यही है।
और बाकी जरूरी सामान?
वो भी है।
ठीक है, बस्ती वालों को खबर करते हैं, शायद सबको अभी रात कैंप के लिए निकलना पड़े। चलो चलो जल्दी आओ।
आपके हित में तत्पर एनडीए में।
कितना अच्छा अपना जहां, कितना अच्छा अपना जहां, सुंदर रखना हम सबका काम।
देखो कितना आसान है अपने गांव, अपने देश का गर्व बढ़ाना। अपनी बहू बेटियों के लिए आप भी अपने घर में शौचालय बनवाएं।
तो आओ करें निर्मल भारत का निर्माण।
फानुस बनके जिसकी हिफाजत हवा करे, वो शमा क्या बुझे जिसे रोशन खुदा करे। ये पहल है उनके नाम जिन्हें विश्वास है खुद पर, जिन्हें नाज है अपने सपनों पर, जिन्होंने अपनी तदबीर से अपनी तकदीर बदल दी। ऐसे ही मजबूत इरादों की दास्तां, हौसलों की उड़ान।
Welcome back. This is Healthy India, and today we are telling you all about dengue fever. Yes, people, it is in the air, and you need to know as to how you can save yourself, how this can be prevented, and what kind of hygiene you need to maintain around your house or any surrounding that you work in or live in. Well, at this point, I invite you to ask your questions to the panelists here. For that, you need to know the number, which is 1800115314, and the other number is 23035420. So pick up your phone and dial these numbers, and you can get your answers right away. Well, now we have been talking about how the disease manifests itself, but talking about the diagnosis, Dr. Singh, what is the right time for a person to whom you will suggest a blood test or any other test?
Okay, I think we need to be very clear about two aspects here. Dengue virus has got 4 serotypes called dengue 1, dengue 2, dengue 3 and dengue 4. The different serotypes are responsible for different cases in different years also. Normally we see that dengue 2 and dengue 3 are the serotypes which are very common and are responsible for most of the cases of DHF, that is dengue hemorrhagic fever and dengue shock syndrome. That's one. For diagnosis of this particular disease, we have two kind of tests basically. The third category of test is also available, that is mainly for research and academic purposes. But for routine, we have what we call as NS1 antigen test, which people might have heard about or read about in newspapers, but that is not a very specific test. The very commonly used and a good diagnostic test is the ELISA test, which is usually undertaken after 5 days of fever. So, you can't really diagnose dengue with confirmation in first 5 days.
All right.
Is mainly based on the clinical symptoms, which are very suggestive of dengue.
Which you just mentioned.
Which we just talked about a few minutes ago. I think the point which you raised was very pertinent. If somebody has fever in the family, what is to be done? And Dr. Raheja explained that. I would suggest, first of all, do not panic, number one.
Right.
Get a qualified doctor's consultation in your neighborhood, be a government health facility or a private practitioner or wherever. Once you show yourself to a doctor, the doctor will be able to tell you whether you are likely to have dengue fever or not, or is it some other kind of fever. And most of the time, as we all know, dengue, even if it is likely to be dengue fever can be managed very successfully at home with simple interventions. You don't have to rush to a big hospital or for testing, just in case you have fever. Fever can be because of many reasons. It is also malaria season for that matter. One can have malaria, one can have dengue, one can have H1N1 influenza, one can have simple viral fever. So, one has to really see a doctor first and then decide the next course of action.
Well, people, so I think what's something very important that has come up is that first thing is that you do not need to panic, because if you do, you will not be able to take the right steps, which you have to in any case. Well, at this point, we are joined by Mr. J.N. Rao. So, Mr. Rao, if you're with me, what's your question?
Good evening, Healthy India. My question is, first, why can't the common dengue mosquito be eliminated from places identified like marshy, stagnant water? Second, in spite of great progress in science, when dengue was first discovered in 1779, why has mankind failed to find a vaccine for the disease dengue?
Right.
Thank you.
Well, that's a good question, and let me put the doctors in the dock here. Yes, Dr. Raheja.
Yeah, basically, as Dr. Bir Singh has discussed, that dengue has got 4 serotypes, DN1, DN2, DN3, DN4. So, the person who gets infection from the one serotype is immune to only that serotype. And if he gets the infection from the second or different serotypes, the chances of developing dengue hemorrhagic fever or dengue shock syndromes, they are very high because of the antibody enhancement. And in dengue, there are a lot of research going on. A vaccine was developed, tetravalent. You have to have a tetravalent vaccine which should be effective against all the 4 serotypes. Like now we have a Chimerivax vaccine which has been developed in Thailand, and it was successful to the tune of 90% in monkeys. But the only issue was, once it was tried in humans, the success rate was 20%, because if the vaccine is effective for 3 serotypes and fails to act against one serotype, if the person gets infection of that serotype, it will be a bigger disaster.
Right.
Because of the antibody development enhancement, the antibodies are high for other serotypes. And because of all these complex procedures, complexity of the virus and the complexity of the virulence of the virus, it has been a big issue to discover a vaccine which can be effective against all these serotypes. And we are in the stage 2 trials of the vaccine making, and maybe we get it in next few years, hopefully.
All right. So, well, we can't say those few years, what would be the number of those few years, but well, we all can only pray that yes, there does come a vaccine for dengue and we all can prevent ourselves from this deadly disease. Well, in certain cases, not always. Well, now we are joined by Sanjeev Srivastava from Patiala. So, Sanjeev, if you're with me, what's your question?
I'm not asking any question. I'm just requesting you to just put this program in Hindi instead of English, because generally...
Right. Yes, Mr. Sanjeev, thank you for that suggestion, and but I'd like to inform you with all humility that in case if anybody does ask their question in Hindi, we will answer the question in Hindi. Well, certain programs have to be done in English, and this is just one of those. Well, now again, so when he says few years, as I said, those few years can be whatever, but I think still we can prevent ourselves from this disease only if we look after our surroundings. So, as a doctor, what would you like to tell the common public today?
Yes, basically dengue is coming as a public health problem. when we have a treatment, there is no specific treatment. We have to take the preventive measures only. We have to understand, because this virus is transmitted through mosquito bite.
Right.
We have to prevent the reservoir, the breeding sites, maybe inside the house or around the house. Inside the house, there may be overhead tanks, maybe some pots, broken bottles, money plants bottles, or outside the house there may be tires, maybe broken tins where the collected water is there. And this mosquito breeds in a fresh or clean water. So we have to take care of that part. And for once the virus is there, this mosquito is there, we have to prevent from human being from the biting. Because it is a day biter, 2 hours after the sun rise and 2 hours before the sun sets. These are the maximum biting timings.
Okay.
It can
but
bite in the
does that
times.
mean that it cannot bite any other time?
Yes, it can bite another time. These are the maximum biting timings where the research says ki it is duration is there. But for the people which are day sleepers, like the people which are working in the night, they should use the chemical based nets, or the child, the infants which are there in the day, they are sleeping, those can be prevented by having a nets. The mosquito repellents can be there. The other nets available in the house.
Right, right. Well, we will definitely talk about that a little more in detail as to how else can we prevent ourselves. But before that, we have with us Mr. Ashok from Delhi. So Ashok, if you're with me, what's your question?
Sir, I have heard that it is not wise to take antibiotics while some people who are suffering from dengue fever. So if we are not going to take antibiotics, what do you suggest, that how can we prevent our fall in the platelet counts? Do you suggest that high vitamin C intake will be one of the measures by which we can prevent our fall in the platelet count?
Yeah, thank you so much for that question. I think that's a very important question. So, Dr. Singh, I'm sure there must be many other people who would want to know the answer to that.
I think let us be very clear. It's a viral disease, and antibiotics do not really act against viruses. That's one. So dengue fever will also probably is one disease where you will have no role of antibiotics here. And as has been explained, it's basically the supportive management. That means keep the fever down, keep the body hydration well, eat well, rest well, are the basically hallmarks of good treatment in dengue. Now, by taking antibiotics, we can't really prevent that fall of platelets as he is saying. No, it's not correct. Platelets have nothing to do with the antibiotics. And as I said, there is no specific treatment for dengue. It is only the supportive symptomatic treatment, so that the patient is able to get over that period of 5 to 6 days and come out of this successfully. And believe me, 90% or more of the times, the patient will come out successfully from dengue this thing problem.
Right. And what about that vitamin C question?
No, vitamin C has again no role in dengue as such, but vitamin C etc. generally may be good for health, but not for dengue alone. I don't think we can really say that dengue will be kind of cured or treated.
Specifically on dengue, basically there is no role of steroids, there is no role of antibiotics, only the supportive management, as Dr. Veer Singh has talked.
The most important point is
Well,
maintaining
Dr.
good
Raheja, I have
hydration.
to interrupt you for a moment, as right now we are joined by Mr. Kapil Dev Gupta from UP. So, Mr. Gupta, welcome to the show.
Thank you, ma'am.
Yeah, please go ahead.
Thank you, ma'am. Thank you, ma'am. मैडम, मैं लखीमपुर खीरी यूपी से बोल रहा हूँ। ये हमारे लखनऊ से बहुत दूर है और यहाँ पर कोई भी मेडिकल फैसिलिटी नहीं है, इसलिए मैं ये जानना चाहता हूँ।
You'll have to lower the volume of your TV set. So, people, if you are watching, I'd like to remind you that when you talk to us, please lower the volume of your TV sets and talk to us only through your telephone sets, because that's the only way that I can hear you and that's the only way that you will be getting your answers. But whatever the gist that I have got is that in certain places, Dr. Raheja, if there are no medical facilities, तो वो ऐसी उसमें वो क्या करें अगर ऐसा कुछ हो तो?
हाँ, ज़्यादातर जो भारत के लोग हैं वो गाँवों में रहते हैं, छोटे कस्बों में रहते हैं और वहाँ पर जो मेडिकल फैसिलिटीज़ हैं बहुत लिमिटेड हैं
जी। तो
ऐसे पेशेंट्स के लिए सबसे ज़रूरी है कि वो अपना हाइड्रेशन मेंटेन करें। किसी भी टाइप का बुखार हो, डेंगू हो, वायरल हो, क्योंकि हाइड्रेशन अच्छा रखने से जो ब्लड प्रेशर है, पल्स प्रेशर है, वो अच्छा रहता है। ओरल इनटेक अपना अच्छा रखें, उससे बॉडी का इम्यूनिटी सिस्टम इम्प्रूव करता है। और जो भी नज़दीकी स्वास्थ्य केंद्र है, अगर वहाँ चले जाएं तो बहुत ही अच्छा है। सेल्फ ट्रीटमेंट जो है वो भी ज़्यादा अच्छा नहीं है। प्रिकॉशन में
कि वहाँ पर उनके यहाँ कोई मेडिकल फैसिलिटी है ही नहीं, तो
उनको ऐसे में उनको सिर्फ यही है कि प्लेन पैरास्टामोल की टैबलेट ले सकते हैं। जो एडल्ट हैं उनके लिए हम 500 मिलीग्राम की एक टैबलेट रिकमेंड करते हैं
जी।
जो 4 साल के बच्चे हैं उनके लिए अप्रॉक्सीमेटली आधी गोली, और छोटे बच्चों के लिए 1/4 125 मिलीग्राम। और इसके लिए उनको जो ओरल इंटेक है वो अच्छा रखना है। बुखार को अपने हाइड्रोथेरेपी से अच्छे से कंट्रोल करना है। और डेंगू में जो फीवर होता है ये बाईफेसिक होता है। पहले 4 दिन तक हाई ग्रेड फीवर आएगा 104, उसमें ठंड भी लगेगी, शरीर में दर्द होगा, आँखों के पीछे दर्द होगा, मुंह एकदम लाल हो जाएगा, फ्लशिंग हो जाएगी, रैशेज भी निकल सकते हैं, ब्लड प्रेशर भी नीचे गिर सकता है। तो अगर हाइड्रेशन अच्छा रखेंगे तो ब्लड प्रेशर मेंटेन रहेगा। और हमने कुछ स्टडीज़ में ये भी देखा कि अगर हाइड्रेशन अच्छा रखते हैं और जो पेशेंट इंटेक अच्छा रखते हैं ओरली, उनके अंदर जो प्लेटलेट वाला कॉम्प्लिकेशन है ये भी कम होता है। और जो डेंगू शॉक सिंड्रोम के चांसेस हैं वो भी कम हो जाते हैं। डेंगू हेमरेजिक फीवर के चांसेस भी कम हो जाते हैं। सबसे ज़रूरी है कि इनको एस्प्रिन, हमने शुरू में बताया था, ब्रूफेन, डाइक्लोफिनेक, एनसेट्स वाली दवाइयाँ नहीं खानी है, क्योंकि वो प्लेटलेट को नुकसान देती हैं, प्लेटलेट के एक्शन को और कमज़ोर कर देती हैं। और डेंगू में पहले से ही जो प्लेटलेट है उनके अंदर दो तरह का डिफेक्ट होता है। एक तो वो मात्रा में कम हो जाते हैं, और दूसरा उनका जो कार्यशैली है वो क्षमता कम हो जाती है। तो इन दोनों चीज़ों को हम ध्यान में अगर रखें तो हमें ऐसी दवाई कोई नहीं खानी जिससे कि प्लेटलेट और कम होने का।
That's right. So which means that even if people are taking some kind of self medication, you have to really know that it is only paracetamol that is going to work and no other medicine. At least that's what I am gathering today. Well, now we are joined by Mr. CM Jetli from Mumbai. So Mr. Jetli, if you are with me, welcome to Healthy India.
हाँ नमस्कार, मैं यहाँ नवी मुंबई की बात कर रहा हूँ कि आदमी को किसी भी तरह का फीवर होता है तो लोग क्लोरोक्विन और प्राइमाक्विन जो आती है टेबलेट वो है ना दे देते हैं कि मलेरिया का चांसेस है, मलेरिया का ट्रीटमेंट चालू करते हैं। उससे मेरे हिसाब से प्लेटलेट बहुत कम हो के आदमी मरने के करीब पहुंच जाता है। तो उसके कारण क्या करना चाहिए, पहली बात। और दूसरा ये कहना है कि जैसे जो तालाब है उससे तो फ्रेश वाटर होता है, तो डेंगू के जो मच्छर है वहाँ पे अंडे दे सकते हैं, डेंगू फैल सकता है। तो जो नगर पालिका को जो बड़े बड़े तालाब है पानी को, उनके लिए क्या करना चाहिए बचाव के लिए? धन्यवाद।
Right. Well, to your first part of the question, I don't think I'm going to agree, because the doctors will not just treat you for malaria even if you're suffering from some other fever. So that is settled. And now the second part of the question, Dr. Veer Singh, आप कुछ बताना
चाहेंगे? अब मेरे ख्याल से एक चीज़ मैं समझाना चाहूँगा अपने श्रोताओं को, दर्शकों को। पहली बात तो ये मैं एम्फसाइज करना चाहता हूँ कि जो लिक्विड्स हैं, तरल पदार्थ हैं, वो इतना पिएं। अगर आपका मरीज होश में है, बेहोश नहीं है, तो तरल पदार्थ आप मुंह से दे सकते हैं। खासतौर से जो टेंडर कोकोनट वाटर है वो बहुत इफेक्टिव होता है बॉडी के हाइड्रेशन को ठीक करने में, नारियल का पानी, और प्लेटलेट्स की जो संख्या है उसको भी स्थिर करने में रखा रहता है। सेकेंड थिंग आई मस्ट एम्फसाइज हियर, it has always been a fight between man and mosquito over the last so many centuries.
That's right.
Right? And sometimes the mosquitoes win, sometimes we win. And there was a time when we were able to control malaria, etc. in 1960s. But then malaria has come back, dengue has come back. And malaria and dengue have come back mainly because of man-made activities. Essentially, so much of construction work is going around, so much urbanization. You have facilities for rapid transportation, and that is why the mosquito breeding is taking place more, and that is why we are not able to eliminate. You know, one of the viewers was asking this question, why are we not able to eliminate this?
Yes,
because we have not been able to eliminate the mosquito.
That's right.
If we are able to overcome mosquito, we are able to overcome malaria, dengue, chikungunya and whatnot.
That's right. Well, at this point, we are joined by Sadiq from Delhi. So, Sadiq, if you are with me, welcome to Healthy India. Sadiq, are you there?
हाँ, सादिक बोल रहे हैं। बहुत शुक्रिया बात करने के लिए। मेरा 2 सवाल है जी। पहला सवाल ये है कि एक ही मच्छर खतरनाक वाला जो है उसकी एक ही बाइट जो है वो ये मरज पहुंचाने के लिए काफी है। और दूसरा सवाल ये कि अगर घर में कोई है इन्फेक्टेड तो उसको काटा हुआ मच्छर जो है दोबारा घर के किसी दूसरे मेंबर को या काट लेता है तो ये उसको ट्रांसमिट हो जाता है। और दूसरा सवाल हमारा स्वाइन फ्लू के बारे में है कि आजकल मेट्रो ट्रेन है या मतलब सेंट्रली एयर कंडीशन फोर्टिस स्कॉट हॉस्पिटल है, तो इसमें सब बाहर के मरीज आते हैं, वो लोग ये मरज लेके आते हैं, तो उसमें वेंटिलेशन नहीं होता, तो उसमें ये मरज फैलने के कितने चांसेस हैं? ऐसा होना चाहिए कि नहीं होना चाहिए? 2 सवाल
जी। सादिक, थैंक यू वेरी मच। आपने ये बहुत इंपॉर्टेंट से सवाल पूछे हैं। तो डॉक्टर कुमार, सबसे पहले मैं चाहूंगी आप इसका जवाब दें।
जो उन्होंने पहले बताया कि अगर एक मरीज है, अगर उसको मच्छर बाइट काट रहा है, क्या वो दूसरे मरीज को भी हो सकता है? बिल्कुल ठीक बात है। अगर घर में कोई ऐसा पेशेंट है और जो कि डेंगू से ग्रस्त है, अगर मॉस्किटोज को बाइट करता है तो वहां से वो इन्फेक्शन लेके अगर वो मच्छर किसी और घर में परिवार के सदस्य को काट रहा है तो वो इन्फेक्शन ट्रांसमिट हो सकती है। मतलब ये हुआ कि एक ह्यूमन बीइंग से ह्यूमन बीइंग में नहीं है, लेकिन बीच में अगर मॉस्किटो आ गया है तो इन्फेक्शन दूसरे आदमी को ट्रांसमिट हो सकती है। जहां तक इन्होंने स्वाइन फ्लू की बात की है, जो सेंट्रलाइज एयर कंडीशनिंग है, अगर वहां स्वाइन फ्लू H1N1 की इन्फेक्शन है तो सेंट्रलाइज एयर कंडीशन से वो आगे ट्रांसमिट हो सकती है। जितने भी हमारे आइसोलेशन वार्ड्स होते हैं स्वाइन फ्लू के, चाहे वो अपोलो हॉस्पिटल हैं या हमारे गवर्नमेंट के जो रजिस्टर्ड हॉस्पिटल थे, जब भी यहाँ स्वाइन फ्लू का एपिडेमिक हुआ था तो उनकी जो एयर कंडीशनिंग थी वो इंडिपेंडेंट की गई थी, सेपरेट की गई थी बाकी अस्पताल से।
So this is a point which people must know. Well, folks, at this point we'll have to slip into another break, but do stay tuned as we'll be back very quickly.
बच्चे, बूढ़े और औरतें सबसे पहले साइक्लोन शेल्टर की ओर चले। तूफान की संभावना है।
चलिए काका, आप लोगों को तो सबसे पहले जाना चाहिए था साइक्लोन शेल्टर।
कैसे जाएं बेटा घर बार छोड़कर? कौन ख्याल रखेगा घर का और सामान का?
तूफान आदमी और सामान में भेद नहीं करता काका, सब बहा ले जाता है।
और जान सलामत रही तो ये घर आप फिर से बना सकते हैं। चलिए साइक्लोन शेल्टर।
चलिए काका।
आपके हित में तत्पर एनडीए में।
नारी तुम में ही तो है पर्वत की महानता, सागर की गहराई और धरा की विशालता। अबला नहीं सबला हो तुम, व्यक्तित्व की अस्मिता हो तुम। आपकी आवाज हमारी कोशिश अस्मिता। हर गुरुवार रात 10 बजे सिर्फ लोकसभा टेलीविजन पर।
आज मौसम तो काफी खराब है, कहीं तूफान तो नहीं आएगा? रेडियो पे सुनता हूँ।
तूफान की आशंका है, मछुआरों को सावधान किया जाता है कि वो समुद्र की ओर ना जाए।
कमला, तूफान आ रहा है। हाँ? सेफ्टी किट कहाँ है?
हाँ यही है।
और बाकी जरूरी सामान?
वो भी है।
ठीक है, बस्ती वालों को खबर करते हैं, शायद सबको अभी रात कैंप के लिए निकलना पड़े। चलो चलो जल्दी आओ।
आपके हित में तत्पर एनडीए में।
बहन जी, रोशनी के माँ और पिता आए हैं।
बहन जी नमस्ते।
नमस्ते। रोशनी की पढ़ाई अच्छी चल रही है। आजकल मैं उसे गणित में जोड़ और घटाने के सवालों का खूब अभ्यास करा रही हूँ। बहन जी, सवाल हो गए। रोशनी की कॉपी तो देखिए, कल 10 में से 8 सवाल ठीक थे, आज सारे 10 के 10 ठीक हैं। शाबाश रोशनी। शाबाश रोशनी। स्कूल चले हम।
Welcome back. This is Healthy India, and today we are telling you all about dengue fever. So people, if you still have a question on your mind, this is your time to pick up your phone and dial 1800115314 and 23035420. Just remember to keep the volume of your TV sets to the bare minimum and only talk to us through your phones. And I promise you, you will get all your answers right here, right now. Well, now we all know that dengue is something that number of people are fighting against today. But another thing is chikungunya, and the symptoms are, I think, almost the same. So how can a person differentiate that on his level, or only it can be done after it has been diagnosed through a blood test?
Yes, the two are running together.
Right.
And you know, this year we are having a lot of chikungunya patients also.
Right.
Whereas the signs and symptoms to begin with, they are same. And in chikungunya, the arthalgia is a more common symptom, which will last for a longer time also. And best way to differentiate between two is doing the ELISA test, which is more practical way. We have got the ELISA test for dengue as well as chikungunya also. और dengue fever का जो the fever is biphasic. It is high grade in the first 4 days, 5th day it differs, decreases, and it again comes back, and 7th, 8th day the patients can go into dengue hemorrhagic fever or dengue shock syndrome. And that is the most important time when the patient should be taken care of. By maybe the patient will require, if they are developing dengue hemorrhagic fever or dengue shock syndrome, IV fluids, and in very few cases I will say, because this year I have not used any platelets. I have treated more than 100 patients admitted in my hospital itself.
Right.
So you learn with experience.
True.
And in chikungunya, the symptoms are same, and in the pain in the joints can be debilitating. Patient may be not be able to walk to the toilet even.
Right, right.
You know, chikungunya itself means bending. So the patient is walking with a bend forward. And the pain may persist for even 2 weeks, maybe 6 months or a year in chikungunya. Whereas the dengue fever can lead to a more serious complication of dengue hemorrhagic fever, dengue shock syndrome. Chikungunya is more of a disease which can be more of a troublesome, debilitating in the form of joint pains which will persist for months in few patients. And in that the treatment lines are different.
Okay, well, and maybe the
patient must consult the doctors at the right time.
That's
and
right.
differentiate between the two, and they can be accordingly given the treatment.
Well, so people don't try to diagnose everything by yourself. You will definitely have to go to a medical doctor. Well, at this point, we have with us Sanjay from Chennai. So, Sanjay, if you can hear me, what's your question?
Hello, madam. Hello, madam.
Yeah, Sanjay, go ahead.
I have a sneezing problem also, madam, first 1 week.
Okay.
Sneezing problem. What is the cause for that, madam?
I just could not get you clearly. Please, can you come again? You have
Can you please repeat the question?
All right. Well, I don't think we have been able to catch exactly what you've been trying to say, but people, in case if you have just joined us, this is Healthy India, and today we are only telling you about dengue fever. So if you have a question regarding that, do feel free to call us, as the doctors will answer all your queries now. Now, Dr. Kumar, we have been talking about the fluid diets for all that time. Now, when is it time for the person to actually start taking normal diet, if somebody has been suffering from dengue, that is?
Okay, and when we will see a patient has recovered, basically, once the patient is having a fever, or the patient has been subsiding from the fever, then there is improvement in appetite, when there is urine output is normal, and the hematocrits, they are coming towards a normal number, then we can say the patient has improved and he can take the normal diet. Otherwise, during the fever also, he can have a plenty of fluids, normal diet he can take.
All right. Well, we will talk a little bit about that in detail, but before that we have with us Mr. Hari Om from Delhi. So, well, Mr. Om, what's your question?
ऐसा बेटे कि मैंने पहले सुना था कि ये मॉस्किटो जो है ये कुछ हाइट तक ऊपर जा सकते हैं, उसके ऊपर नहीं पहुंचते। क्या ये सच है? दूसरी बात, 1953 में जब मैं दिल्ली में आया था बाहर से, हम सड़कों पर गलियों में सोते थे तो मच्छर नहीं काटता था। अब ये मच्छर जगह जगह पहुंचे हुए, क्या कारण है?
जी, डॉक्टर बीर सिंह, व्हाट ही सेइंग इज कि ये मच्छर ज़्यादा ऊंचा नहीं उड़ता है, ऐसा उनका मानना है, ऐसा वो सुनते हैं। सो ये बात, पहली बात सच है कि नहीं?
देखिए, जो एडीज मच्छर है जिससे डेंगू फीवर फैलता है, ये बात सही है कि इसकी 2-3 खास बातें हैं। 1-2 बात तो पहले ही बोली जा चुकी हैं कि दिन के टाइम भी ये काटता है, जबकि नॉर्मली बाकी मच्छर नहीं काटते हैं। बहुत ही फियर्स और ब्रेव मच्छर है, डरता नहीं है, इसलिए इसे बहुत बहादुर मच्छर भी कहते हैं, अगर बहादुर शब्द सही है तो। जबकि फैक्ट ये है कि एक बार बाइट करने के बाद इट कीप्स ऑन अटैकिंग दी पर्सन्स अगेन, इट वांट्स मल्टीपल मील्स, इसीलिए ये एक ही बाइट से संतुष्ट नहीं होता, कई लोगों को एक ही टाइम पे बाइट करता है। तीसरी बात यह है कि ये बात सही है कि ये घर के अंदर और घर के आसपास की परिस्थितियों में ही पैदा होता है, और अपने जो जन्म स्थल है, उसका जन्म स्थान है, उससे कोई बहुत ज्यादा दूर नहीं जाता, मतलब जहां पे ये ब्रीड करता है उसके आसपास ही रहता है। और ऊंचाई की बात यह है कि हाँ, ज्यादा ऊंचाई पे भी नहीं उड़ता है, इसलिए इसकी जो फ्लाइट है जहां ये पैदा हुआ है उससे कोई बहुत ज्यादा दूर नहीं होती। और यही कारण है कि आप देखेंगे कि वेन एवर यू हैव डेंगू पेशेंट्स, आप नॉर्मली पाएंगे कि एक क्लस्टर्स में होते हैं। ये एक घर में हुआ है, उसके आसपास भी आपको और सारे मरीज मिल जाएंगे, क्योंकि वही मच्छर वहीं पे आसपास घूम रहे हैं।
That's right.
तो ये इसकी कुछ खास आदतें हैं इस मच्छर की।
Another thing which he said, Dr. Veer Singh, is कि जब वो पहले दिल्ली में आए थे तो उस वक्त मच्छर, वो बाहर सोते थे, मच्छर नहीं काटते थे, लेकिन अभी मच्छर ज्यादा हैं।
देखिए, आई हैव ऑलरेडी सेड राइट इन द बिगिनिंग ऑफ द प्रोग्राम, बिकॉज ऑफ रैपिड अर्बनाइजेशन, रैपिड कंस्ट्रक्शन एक्टिविटी, we have created places where mosquito breeding is taking place more and more, and that is why we are responsible, human beings are responsible for sustaining these mosquitoes, and that is why mosquito breeding is more, that is why mosquitoes are more. So if he is saying he came in 1963 to Delhi and there were not too many mosquitoes, he may be right.
He may be right, that's right.
This mosquito can fly up to 400 meters maximum flight distance.
Well, so that's the answer to the flight of the mosquito, that is. Well, now we have with us Kamlesh from Delhi. So Kamlesh, if you are with me, welcome to the show. Yeah, Kamlesh, can you hear me?
Yeah.
Yeah, please go ahead.
Madam, हाँ मैडम, हेलो
जी बोलिए।
हेलो
हेलो प्लीज गो अहेड क्विकली।
हाँ मेरे को भी चिकनगुनिया हो गया था मैडम। हेलो
Well, I don't think you have lowered the volume of your TV set, so I'm afraid I will not be able to take your call any further. So people, if you are watching, please remember to keep the volume of your TV sets to the bare minimum. Otherwise, I'm afraid I will not be able to entertain your calls. Well, but here was a patient who was a patient of chikungunya here. So anything that you would like to tell the people if there are people suffering from chikungunya today?
Chikungunya patient should be basically treated symptomatically. There are no antibiotics available. They just need a symptomatic treatment, and because in the first few days it is very difficult to differentiate between dengue, chikungunya and viral.
That's right.
And
so in case of chikungunya, how many days does it require for a person to go for a test? As you said, in dengue it is only on the 5th day and next that you can actually...
even in chikungunya the antibodies they appear after 6 to 7 days. It is not immediately that antibodies will be forming. So initially one should take the precaution of as any fever which can be dengue, viral, chikungunya, and they should consult to the nearest medical facility, go for a blood test to differentiate between what kind of fever it is, chikungunya, dengue, malaria, and we have good medical facilities these days.
That's right.
And we can really diagnose in most of the patients what it is.
True.
And pinpoint the diagnosis, and the patient can be managed accordingly.
True. Well, people, I do hope that you are following all these instructions that the doctors today are giving here. Well, now we are joined by Jitendra Kaur from Delhi. So, if you can hear me, what's your question?
Ma'am, I had chikungunya since a month ago, but my pains are so severe that I can't even walk even now.
Right.
So what can I know for it? What are the medicines I had? When I had chikungunya, I'd been taking Calpol for a week and 10 days. But can I have enough? And because I got enough and more pains, shall I continue with the painkillers?
All right. Well,
yes,
Dr. Kumar.
yes. Actually, chikungunya, the main feature which persists is the joints pain only. They can continue the painkiller with the consultation of doctors only.
All right. Not
whether
by
they
themselves.
should not develop the gastritis or the other features. Just to add in the diagnosis of dengue fever, basically once we have a platelet count, the total leukocyte count, and as we are discussing is a MAC ELISA test which is recognized by the National Vector-Borne Disease Control Program, which becomes positive after 5th day onwards because the antibodies they are in a sufficient number to be diagnosed, to be detected. But in the market commercially NS1 antigen is also available which detects the antigen after 5-6 hours only.
Okay.
And the sensitivity and specificity is around 80 to 90% which they claim basically. Once if both tests they are combined in a periodic manner, the probable we can confirm the dengue fever early so that the fatalities or complication can be prevented in dengue fever.
So does that mean that if somebody is suffering from some kind of a fever, just one test may not be enough?
Yeah, obviously one has to investigate the fever cases. Fever is a symptom and there are many reasons for fever. One can, in this particular season, as has been said again and again, can be dengue, can be chikungunya, can be malaria, can be simple viral fever, can be enteric or typhoid fever for that matter. So one has to investigate and get it investigated scientifically by a qualified doctor in a government health facility, maybe.
That's right. Well, at this point now we are joined by Aarti from Delhi. So Aarti, if you are with me, welcome to the show.
Thank you very much. My name is Arthur Hassan. I have a patient.
Right.
He was suffering from dengue. Like we took him to AIMS. Everything was perfect. We bring him back to home. After 3 days, he got a severe heart attack. So is there any relation between a dengue and a heart attack?
Well, I think that's an important question, but we'll take the answer after this break. So you'll have to wait on for a little while as we'll be back very quickly.
Hello and welcome to In Transit.
Slumdog is definitely a very important work because given the fact that it was a far more difficult film to be able to be shot live in Bombay.
Relationships have become duty beyond duty.
Some of my photographs were published in a couple of newspapers and magazines.
बच्चे बूढ़े और औरतें सबसे पहले साइक्लोन शेल्टर की ओर चले। तूफान की संभावना है।
चलिए काका, आप लोगों को तो सबसे पहले जाना चाहिए था साइक्लोन शेल्टर।
कैसे जाएं बेटा घर बार छोड़कर? कौन ख्याल रखेगा घर का और सामान का?
तूफान आदमी और सामान में भेद नहीं करता काका, सब बहा ले जाता है।
और जान सलामत रही तो ये घर आप फिर से बना सकते हैं। चलिए साइक्लोन शेल्टर।
चलिए काका।
आपके हित में तत्पर, एनडीए में।
एक शक्ति, एक ताकत, जिसने अन्याय के आगे कभी हार नहीं मानी। जो सदैव सत्य और अहिंसा की राह पर चलता रहा। आज संपूर्ण विश्व जिसके सम्मुख नतमस्तक है, महात्मा गांधी।
Welcome back. This is Healthy India, and today we are talking all about dengue fever. Well, we've told you as to how this fever manifests itself and what can be done if you are diagnosed with dengue fever. Well, just before we went to the break, we had Atif Hussain with us who had put a question to us. Would you like to take him?
Yeah, the dengue can be a very mild disease in most of the patients, but it can go to the dengue hemorrhagic fever and the most fatal form, that is dengue shock syndrome. And in the second, I mean dengue hemorrhagic fever, dengue shock syndrome, there is a plasma leakage also. It leads to the serositis. There can be collection of fluid in the lungs, pleural effusion, there can be ascites, collection of fluid in the abdomen, there can be hepatitis, involvement of the liver,
No, but I
there
want to
can be
know-
myocarditis,
Yeah,
involvement of the heart.
Yeah, when you say involvement of the heart, so what does it, in very simple terms, Dr. Raheja, you will have to explain here so that the common people will understand.
All this occurs in the severe form of the dengue and in very, very few patients.
Oh,
and
right.
this is the fatal form of the dengue, which needs a very, very particular care in the ICUs. The patient should be on the monitors, the cardiac enzyme should be monitored, cardiac output should be monitored. And we had a patient which had a lot of symptoms, starting from the hepatitis, liver enzymes going to 2,500, 3,000, automatically they settled down. No particular medicine was given. They are self-recovery. Similarly, myocarditis will also settle down. Ascites will also recover back in the phase of recovery. Effusion will disappear. And at the end of second week, you will see the patient gets almost to normal with good appetite.
Right.
And even the platelet count, which has gone down to 25,000, 28,000, stabilize there. And there should not be any panic. The only thing is, even patient should not worry about it. The more important is they need a very, very meticulous management in the form of IV fluids. How much of the fluid they need orally and in the IV, they should maintain their blood pressure, pulse pressure. They are very, very important.
Care. That is
and
what is
particularly
really
in
required.
children.
Right.
In children, the mortality is very high because they need a very particular amount of IV fluids. If you give more, the patient can land up in fluid overload. And if you give less, the patient can go into dengue shock syndrome, leading to more complication of disseminated intravascular coagulation.
So I think what really comes down to, it boils down to the fact that you have to be under a medical supervision only. Well, now we only have time for one call. Now this is Deepak from Gurgaon. So Deepak, can you hear me?
Yeah, I would like to ask a question, that is fogging effective in dengue fever? That is always done by the health department.
All right, okay, whether it is helpful or not, Dr. Kumar.
Yes, actually, basically dengue is spread by mosquito, and any kind of strong fogging is effective against the mosquitoes. As for the other parts of the prevention they are concerned, basically we have to focus on the source reduction, which is the mosquito, where the mosquito is breeding. And second is, once there is a breeding mosquito is there, we have to prevent ourselves from bite from the mosquito. Third is, like earlier question somebody has asked, some pond is there, water collection is there. Then there are larvivorous fishes are there, gambusia fish, which can kill these larvas and pupas of the mosquito. This is how we can prevent the spread and the mosquito.
All right. So, Dr. Singh, what would be your tips to the people as to how can they prevent themselves from dengue fever?
Okay. As far as fogging is concerned, it only reduces the adult mosquito population in a community. So, the mosquito density will come down and bites will go, lesser in number. But I think the important point is source reduction, as Dr. Pawan just now said. Please ensure that it is not the duty of civic authorities alone. Let's talk about Delhi. It is not MCD or NDMC only.
Right.
We alone are responsible for prevention of mosquito breeding within our houses and around our houses. हमारी भी उतनी जिम्मेवारी बनती है कि हम अपने घर के अंदर और घर के बाहर के जो अपने आसपास का एरिया है वहाँ पे मॉस्किटो पैदा ना होने दें और ये बहुत आसान है. You just have to ensure that there are no water collections which are unattended and mosquitoes do not have an access to these water bodies or water collections ताकि उसमें वो अंडे ना दे पाएं. अंडे नहीं दे पाएंगे तो मॉस्किटो ब्रीडिंग नहीं होगा. और दूसरी बात है कि मॉस्किटो ब्रीडिंग के अलावा मॉस्किटो बाइट से आपको प्रिवेंट करना, खासतौर से बच्चों के बारे में. आई थिंक आई विल लाइक टू रिक्वेस्ट ऑल द पेरेंट्स टू मेक श्योर दैट द चिल्ड्रन व्हेन दे गो आउट इन ओपन इन दिस सीजन दे आर वियरिंग फुल स्लीव्ड क्लोथ्स. And if you can, please use some mosquito repellent creams. They are all safe, as we all know. Mosquito mats in the household so that the mosquitoes are kept away. If you have facilities and if you can afford, please put wire mesh, जो जाली वाले दरवाजे वगैरह जो है वो लगाएं ताकि मॉस्किटोज अंदर ना जाएं. और अगर आप मॉस्किटो नेट्स यूज कर सकते हैं जरूर करें. खासतौर से जब आपके घर में किसी को डेंगू हो जाए उस व्यक्ति को आपको मॉस्किटो नेट के नीचे रखना बहुत ज़रूरी है ताकि वो सोर्स ना बन जाए बाकी लोगों के लिए. और आपके एरिया में अगर कहीं भी फीवर के ज़्यादा केसेस नज़र आते हैं तो प्लीज़ इन्फॉर्म योर लोकल अथॉरिटी सो दैट अप्रोप्रिएट स्टेप्स कैन बी टेकन immediately.
That's right. Now, mosquito repellents. I'm glad that he mentioned mosquito repellents. So these days there's a galore, of mosquito repellents in the cities. So, but what do you recommend as a doctor? That what is the best? Is it the repellents in the form of ointments, or are those coils enough, or are those liquid, fumes that we all see all around?
Yeah, we have got different, vaporizer machines. They are safe. Only thing is the person should not be allergic to it.
That's right.
In asthmatics and the people those who are allergic, and even during fogging also, I would make a request to all the people to open their doors and windows at the time of fogging, because and there should be a good coordination between the government and the people.
That's right.
What happens when the fogging is going on? Normally people they shut down their doors, so the mosquito will be killed in the environment, but it will remain hide in the house.
That's right.
And again that is a source of breeding to multiply. And even those patients, those who are asthmatic or allergic to this fogging issue, they can just take precaution accordingly.
That's right. Well, people, I do hope that you have gained a whole lot of information regarding dengue fever today. But just in case if you have missed out on any part of our discussion, please take a look at this recap.
Symptoms of dengue: chills, flushed face, increase in temperature, rash and headache. Rash consists of small red bumps that begin on the arms and legs but then spread to the back, abdomen and chest. Lower back pain and general weakness. Red eyes and eye pain. Severe joint and muscle pain. Swollen lymph nodes. Soles of the feet and palms of the hands also turn red and swell. Key facts: dengue is a mosquito-borne infection that causes a severe flu-like illness and sometimes a potentially lethal complication called dengue hemorrhagic fever. Global incidence of dengue has grown dramatically in recent decades. About 2/5 of the world's population is now at risk. Dengue is found in tropical and subtropical climates worldwide, mostly in urban and semi-urban areas. Dengue hemorrhagic fever is a leading cause of serious illness and death among children in some Asian countries. There is no specific treatment for dengue, but appropriate medical care frequently saves the lives of patients with a more serious dengue hemorrhagic fever. The only way to prevent dengue virus transmission is to combat the disease-carrying mosquitoes.
Well, I think prevention is the cure in case of dengue. If we only talk about dengue, well, if you prevent yourselves, you will definitely be saved from this disease. Well, people, I do hope that you enjoy all the discussions that we hold here only for you. But I would like to know exactly what more you would like to see in Healthy India. For that, you need to write to me, for which my address is
Healthy India, FB 116, Lok Sabha Television, Parliament Library Building, Parliament House, New Delhi 110001. Email healthlstv@gmail.com and our toll-free number is 1800115314.
So keep writing into us. As I always tell you that your mails mean a lot to me as well as to my team. So I do wait for your mails, so keep them pouring in. Well, at this point, I'd like to say thank you to all three of you for taking time out and for talking about dengue fever with me as well as with my viewers. Well, people, I do hope that in this 1 hour, you have learnt as to how to prevent yourself from dengue fever, and just in case if you are diagnosed with it, what you are supposed to do. If you know the symptoms that we've just talked about, all you need to do is go to a doctor, and as the doctors here have said, that this kind of fever will only be established after 5 days. So don't miss out on that test, and in case the test is not clear, please go for the test again and have a lot of fluids and take care of yourself and prevent it. And you can use all those kind of mosquito repellents that we've talked about. If you do all these things, at least you will be free of dengue. So with that, it's a wrap up of today's edition of Healthy India. I'll see you next week. Till then, this is Lottie Alaric saying goodbye and take very good care of yourselves.
आवाज फिर आवाज है, कभी पास कभी दूर पहुंचती है आवाज, रोके कब रुकती है आवाज। आज यही आवाज बन के आ रही है आपकी आवाज, आम जनता के लिए और आम जनता की चुनी हुई आवाज। यही होगी आम इंसान की आवाज, जो बनेगी हिंदुस्तान की आवाज। सबसे आम मगर सबसे खास, लोकसभा टेलीविजन।
एक शक्ति, एक ताकत, जिसने अन्याय के आगे कभी हार नहीं मानी, जो सदैव सत्य और अहिंसा की राह पर चलता रहा। आज संपूर्ण विश्व जिसके सम्मुख नतमस्तक है, महात्मा गांधी।
संसद में आता है विधेयक, बनता है कानून, कानून होते हैं आपके लिए, दिखाते हैं आपको कैसे ये कानून आपसे सरोकार रखते हैं। देखिए मेरे साथ संसद से सड़क तक हर सोमवार रात 8 बजे।